Welcome to today's School-Based Health Center peer-to-peer listening and learning session. Next slide. We're going to begin today's session by going through a couple housekeeping items, explaining how to participate in the session and some ground rules. The bulk of the time will be spent in discussion, and we'll conclude by sharing resources, and then you'll be asked to complete a short evaluation. Next slide. We're the School-Based Health Alliance, and we work to improve the health of children and youth by advancing and advocating for school-based healthcare. Next slide. My name is Erin Sullivan, and I'll be facilitating today's discussion. I'm joined by my colleagues Katie and Miranda, who will be monitoring your discussion in the chat box. Next slide. We have no financial relationships to disclose today. The goal of today's session is to provide a space for school-based health center leaders, sponsors, staff, and stakeholders to discuss challenges and strategies related to operations during the pandemic. Today's discussion is specifically going to focus on mental health. There are no right or wrong answers to the questions today. We're interested in learning about your individual experiences and opinions. My colleagues from the Alliance are joining us to take notes, and we'll also be recording so that we can review and analyze what's discussed. We will exclude your names and any other identifying information from the dissemination of this analysis, so your responses will be confidential. Your participation today is completely voluntary, and you can choose not to participate or to leave the discussion at any time. Next slide. In support of improving patient care, CE credits are provided through a partnership with the Weizmann Institute and Community Health Center, Inc. You have to participate in the entire session today to receive CEs. Next slide. Participants must complete the session evaluation in order to receive CEs. This will be shared in the chat box near the end of the session. Next slide. All attendees are in listen-only mode for now, but we want to hear your questions. If you'd like to add your comments through the chat function, please make sure that you select all panelists and attendees before sending the message so that everyone can see it. Based on what's shared, we'll invite participants to unmute so that they can provide more detail about their responses. Closed captioning is available for the session. To access it, please use the closed caption button on your Zoom control panel. As we just practiced, we're going to be using a tool called Menti to facilitate the discussion today. Menti turns all of your responses into data visualizations, which makes it easier to see what your colleagues have said. As we just practiced, after writing your response in Menti, make sure that you hit the blue submit button so that it's included in the data visualization. When you're ready to proceed to the next question, you'll see a button that says next. For some of the questions, you'll be able to submit multiple responses. Once you have said everything that you'd like to say, please click submit and then click next question. Although we'll continue discussing your responses, clicking next question ensures that we capture all of the responses to each question. If you'd like to elaborate on what you wrote in Menti, you can also do that in the Zoom chat feature. After everyone responds in Menti, we'll take a couple minutes to verbally discuss each question and what you wrote. And if you're having any trouble using or accessing Menti, please just tell us in the chat and we can provide more information on how to use it. Next slide. So I know that was a lot of information. If there are any questions, please enter them into the chat. Otherwise, we'll get started. Great. So we're going to begin today's discussion by talking about mental health services generally at school-based health centers. So please go back to the screen where you had Menti open. And as a reminder, you can see at the top of the slide here is the web address, menti.com, and the code that we're using. And just as a reminder, To get to each next question, you need to hit the button that says the next question on your screen. So the first question that you'll see on Menti is, what are the principal challenges of mental health service provision at school-based health centers? And you can share as many as you'd like. After entering a challenge, you can hit submit and then enter another challenge if you'd like. And just like with the question about your states, you'll see that the answers that are entered in the most are going to appear the largest. So I can see that staffing is a large challenge for most of our participants, as is access, scheduling. So staffing is really a principal challenge in mental health service provision, and we'll get into this in greater detail. Oh, I can see language barriers, funding has come up, privacy. So staffing is really the central challenge that is being submitted by most of our participants. Great. Thank you for sharing all of these challenges. So I can see that, again, staffing is the main challenge, as is privacy, parent involvement, funding, stigma, language barriers, access to students, resources. Just for the sake of time, so that we can continue this discussion, we're going to proceed to the next question. So after you've submitted your last challenge, please click the next question button on your screen. So the next question is, what are the principal supportive factors that affect mental health service provision at your school-based health center? So you've mentioned quite a few challenges, but on the other hand, what supports you in delivering mental health services? Great. Teamwork is coming up in the center, as is collaboration as principal supports. District support, supportive staff, funding, which is also mentioned as a challenge, is also a main support. That makes sense, they go hand in hand. School collaboration, teamwork. Great, thank you for sharing all of these. So collaboration is really the central support I see here that's mentioned by most of you. Collaboration and teamwork and staff. So it's really the human resources. Great, whenever you enter in your last supportive factor, please hit the next question screen button so that we can move on. So the next question is, how does the demand for mental health services at school-based health centers today compare to pre-pandemic? So I see a couple people have said increased, so increased demand immensely. So we're seeing increased mental health needs at school-based health centers, increased services, way more, much higher need. So it seems like across the board, demand has increased today compared to pre-pandemic for mental health services. Okay, that's interesting. I see one participant shared that they're unsure of how services have changed because they don't have daily access to students. So I'm sure that's a challenge. And in line with that, I see another person mention that challenges with school going remote or hybrid. Interesting. So one participant shared that it has increased drastically, but the commitment to process has declined. I'm seeing another person mentioned more suicidal ideation. Referrals are down because there's a lack of need and a struggle to coordinate or stay connected. More telehealth visits, decreased services. So it seems like maybe there is an increase in demand, but a decrease in services. Okay, great. Once you enter in your answer, please hit next question so that we can move on. So the next question is, how do students presenting mental health problems and/or diagnoses today compare to pre-pandemic? So I'm seeing more acute needs, increased anxiety, especially social anxiety. I'm seeing another person mention more anxiety, isolation and anxiety, grief and loss, more anxiety disorders are presented. More anxious, feeling overwhelmed. Interesting, parents are requesting more evaluations. Seems to be a more immediate and crisis centered. Virtual or hybrid modules present challenges. More PTSD, more family violence, more child abuse, emotional abandonment. Would anyone like to request to unmute themselves and share maybe a bit more about the presenting mental health problems that they're seeing? To request to unmute yourself, you could just message the panelists or message in the chat if you'd want to elaborate on what you've written. So if you wanted to provide more specific details about the types of anxiety and depression and how that's compared to pre-pandemic. I'm seeing social determinants of health as well. So again, if anyone would like to share what they wrote verbally with your colleagues, please just request that we unmute you. I'd love to hear more about some of the presenting mental health problems that you're seeing.
Miriam, it looks like you may have your hand up. Miriam, I'm going to allow you to unmute yourself if you'd like to chime in. It also looks like Kimberly. Kimberly, you have your hand up, so I'm going to allow you to unmute as well if you'd like to chime in.
I see Rebecca also.
Hey, Rebecca. You should be able to unmute yourself if you'd like to.
Hi, this is Kim Chacha. I'm a nurse practitioner at a school-based health center in Queens. And I was just going to add that there's been such a loss of the factors that typically promote resilience, whether it's after school activities or sports or just social connections, that I think that that is also a part of the increased anxiety and depression and substance use, that a lot of those things that were helping to mitigate some of those factors have been lost this year and continue to be lost.
Mm-hmm. Thanks for sharing, Kimberly. It's a good point.
Rebecca, do you want to jump in?
Rebecca, I am speaking on trends we've seen with school-based health centers around the state of Colorado. And the idea of kind of that crisis response has come up a lot right now. It seems like there's just a lot of presenting of concern for here and now and meeting basic needs, and that the anxiety around that runs high. And then the mood issues really seem related to a lack of engagement, whether it's with peers, the extracurricular supports, that those seem to really be driving a lot of anxiety, but that there's just such a focus on meeting basic needs right now, and parent anxiety around that as well as youth.
Thanks so much for sharing that. Emily, did you say that there was one other volunteer who wanted to share?
I think that Miriam's hand went up early, so it might or might not have been related to this, but Miriam, if you'd like to chime in, you certainly are welcome to. Oh, let's see. It looks also like Carrie is willing to jump in. Thanks, Carrie. I've just allowed you to talk in Zoom, so you should be able to unmute yourself.
Hi, everybody. This is Carrie Blum from Oregon. And on top of a pandemic, we've had statewide wildfires that have displaced a lot of people. And so we're seeing complex grief with multitudes of losses. And we're seeing more complex and acute challenges with individuals delaying accessing services, and including physical and dental health, in addition to behavioral health. So we're quite concerned by all that.
Thanks for sharing, Carrie. Can anyone, the person who wrote parents requesting more evaluation, could they either raise their hand or write in the chat to unmute? I'd be interested in hearing more about that.
It looks like that may have been Camilla. Camilla, if you give me one moment, you should be able to unmute yourself now.
Hi, this is Camilla Galarakis. I'm a nurse practitioner for our school-based health center here in Akron, Ohio. So yeah, we do a lot of pre-visit interviewing with the families before well child visits. And we've added a standard question for all ages to express any mental health concerns that the family has. And I would say about 80 to 85% of the students of all ages that I see, the parents are concerned about anxiety and or depression or changes in the behavior or social interactions that the students are having. So of course, in those ages 11 and older, we're doing the PHQ-9, but then in those younger than 11, kind of having some additional education for our staff on how we're going to screen those students for their anxiety and or depression, and then what interventions we're going to do for them. So we're just, with all of those interviews for the well child visits, are having a large increase in the family concerned about their student and access to resources.
Thanks, Camilla. And it looked like Elena may have put a hand up as you were speaking. So I'm curious about whether Elena may have something to add. Elena, you should be unmuted and able to, to chime in now.
Okay, hi, Elena Roach. I run a school-based health clinic in Cincinnati, Ohio. The one thing I'm finding, and just like I think it was Emily that spoke last, was that I use a screening tool at the beginning, and it does include mental health concerns. And we've embedded the GAD-7 and the PHQ 2 and 9 as just part of like the information kind of like gathering process while they're getting checked in. And I do find that more parents are willing to, compared to pre-pandemic, willing to ask and report more on their concerns with their child's mental health, and just noticeable changes over the past year.
Elena, just to clarify, I'm sure that you said it and I missed it. Are you saying that parents are completing the PHQ or the GAD-7 for their younger children?
No. This part of it is the parents' concerns that list like health concerns, but also mental health concerns. And then the other half of it, the student, the PHQ 2 and 9 and the GAD-7, the student fills out. I wasn't clear on that. So.
Thanks, Elena. I also saw that someone mentioned in a challenge related to mental health service provision that there's an increase in demand for services from older students, but a decrease among middle school students. And I'm wondering if others have also seen that, and if anyone could share more about that. So again, the comment was that there was an increase among high school students for demand, but perhaps a decrease among middle school or other younger students. So if you could share, please just request to be unmuted.
It looks like Nadira and Jasmine have both raised their hands. So Nadira, I'm going to start with you. You're welcome to unmute yourself, and then Jasmine, if you could follow up, that would be great.
Hello, everyone. My name is Nadira. I work at the Quinzen Clinic. We're a school-based health center in Petersburg, Virginia. And we're located inside a high school, but sometimes we do get requests from other districts, from other schools, elementary and middle schools in the area. However, since the pandemic, we have been getting a lot of requests for the high schoolers more so, and not much so for the middle schoolers or the elementary schoolers. We're a new school-based health center, and so in the city, it showed everyone had a need for mental health services. However, the high schoolers more so. And so we have been getting a lot of requests for them. And a lot of times when we do get requests for the younger students, the middle schoolers or the elementary schoolers, it's usually a family thing where it's like the whole family may need some mental health services. So it might be a middle school and a high school together in the same household, and the family wants all their children to get some mental health services.
Thank you. Emily, you mentioned that another participant had their hand raised.
Yeah, Jasmine, are you able to mute and unmute yourself? Let's see. Oh, Jasmine, it looks like you're unmuted if you'd like to chime in. Okay, Erin, I don't know if we want to move on and then if Jasmine's able to join us.
So I see that Rochelle had mentioned delays in diagnoses and limited access to developmental and behavioral services in the chat. If Rochelle, you could share more about that. Emily, if you could help her unmute.
Yeah, absolutely. My name's Shelley. I'm I'm a pediatrician working with, or in coordination with the school-based clinics in Tarrant County, Texas. So that's Fort Worth area. And we've had, in addition to kind of the typical, concerns for attention, and, we're always looking at the, possibility of a comorbid anxiety or depression, or that's, what's really going on is anxiety or depression. But in addition to that, with we had, during the complete shutdown, unable to do appropriate referrals to our developmental behavioral partners in the area, as well as just, overall limitation in the teacher's ability to recognize and attention, when they can just shut their screens off or what have you. And so lots of my Vanderbilts come back saying virtual only. So that's definitely been a challenge. I had a student the other day who's definitely, would appear to me, presented to me with inattention in class, and some profound, learning challenges. We're talking about an 8-year-old coming in and could not write his own name, and the teacher was unaware. So just, in addition to the other things that we've all been shocked by over the past year, that was really disturbing.
Yeah, thanks for sharing that.
Thank you.
Great. So we're going to move on to the next question. And I can see, Colleen, that you're having trouble with Menti, so one of the panelists will help you figure that out. But for now, the next question is, what strategies is your school-based health center employing to administer mental health services? So we've talked a lot about changes and challenges during the pandemic. Now we're wondering specifically what strategies you're employing to meet increased need that you all mentioned you're seeing. So I'm seeing telehealth, his strategy mentioned by most of you so far. Partnering with agencies. So as we're waiting for others to share strategies that they're engaging, if someone who shared that they're employing telehealth could share what's been working well or specific strategies that you're using to deliver mental health services via telehealth, please just ask to unmute yourselves and share. Or if you could share what your implementation of telehealth looks like and how it's working and what successes you're seeing.
Renee, I'm going to unmute you. Certainly no pressure to chime in verbally, but I saw that you shared in the chat. And so if you are able to provide some background, Renee, I'm sure that we would love to hear it.
Sure. So we're really lucky to have the Massachusetts Child Psychiatry Access Project. And it's a consultative and collaborative model where primary care providers, including school-based health centers, so long before the pandemic, fortuitously, we had worked to really solidify that relationship because the nurse practitioners and school-based health centers were just sort of at the very beginning of being able to do those initial assessments for anxiety and depression, and sort of initially treading lightly on potentially maybe starting to prescribe a little bit of psychopharm. And because the comfort level wasn't there, we were like, okay, what can be done? And so introductions were made, and we did some professional development so that they could know these consulting psychiatrists. And you can Google it. It's the website is MCPAP, mcpap.com. And so they are able to collaborate, using telehealth to do, to co-manage the kids, if you will, and to then facilitate referrals. And so it's, it's a really powerful model because you have child psychiatrists who are actually chiming in and communicating directly with the school-based health center clinicians who need it, right? And so, and they can also call when they're up against something that's really complicated and they don't know what to do. And so they can call and actually speak with a child psychiatrist. And then the child psychiatrist will not prescribe the meds, but will actually give their opinion on what they think should be prescribed. And then the advantage is that, well, in normal times when the NP is seeing the kids at school every day, it's very helpful for titrating the doses of medication and monitoring the side effects, and then, you know, seeing the child every day to monitor symptoms and whether the symptoms are being resolved. I see that someone has a similar model in Texas, and I know we're not the only state to have it, but it certainly has been incredibly helpful during the pandemic. You know, not many people are having here faith in the capacity of telebehavioral health services to manage acute crises, right? So for the suicidal kids, our behavioral health clinicians are still feeling pretty nervous, and the parents don't have the same high level of confidence. We saw that in a survey that was done by our parent advocacy league. And so for the kids who are at high risk of having a mental health emergency, I would say that we don't have, you know, it's difficult. It's just really difficult.
Thanks so much. That was just great to hear about what you're doing. I'm seeing comments about different community partnerships to collaborate and improve access. Can anyone unmute themselves and share more about that? Perhaps some examples? You can either write in the chat or raise your hand. So again, the strategy mentioned was community partnerships to collaborate and improve access.
Thank you, Carrie. You should be able to chime in now.
Yeah, I think one of our most powerful collaborations was with the school district. The state of Oregon was able to have all the school districts issue Chromebooks to every student, which really enhanced the capabilities for students and families to be engaged with telehealth. And our school districts lowered the firewall to be able to access any healthcare services. So that was a very powerful tool. We also used some of local and state funds to increase internet connectivity. So those were all really critical things to be able to help people access all health services as well as our school-based health services.
Thanks so much. I also saw someone mention a risk stratification tool, and I'd love to hear more about that if you wouldn't mind unmuting yourself and sharing. Someone mentioned a risk stratification tool as a strategy.
That might have been.
Hi, this is Kimberly again. Yes, so this has actually grown out of a AAP Project ECHO on mental health and adolescence and the use of telehealth. So as we are seeing increased demand for mental health services across our 5 school-based health centers, we're trying to come up with a risk stratification tool that the medical providers can use in referring the students to the social workers. So it's still sort of in development, but we've been using it a little bit with imminent risk, high risk, and sort of a moderate risk, and you know what students need to be referred that same day with a soft handoff, even if that's on telehealth, versus the students that can maybe have follow-up with the therapist in a week or two, versus the students that maybe the medical provider needs to check in on in a few weeks and further assess the need for further services, and providing coping skills, providing resources for crisis services. We are fortunate that we have a behavioral health urgent care that we can refer to in addition to the emergency room for more acute issues. But just we're seeing an increased demand, so the tool is helpful to sort of figure out who are the kids that need the services the most to make sure that we have services available for them.
Thank you so much. I'm also interested in if someone could expand on the group work that has been mentioned as a strategy. And I know that collaboration, teamwork, group work were all mentioned as support. So if anyone could unmute themselves and speak specifically more to that, that would be great. No, anyone want to share more about group work or collaboration or community partnerships as a strategy?
Sort of in a similar vein in terms of the naming, I would be interested. I know some people mentioned that they're either doing or are considering offering some, I don't know if it's psychoed groups or therapeutic groups, but I would love to hear about what kind of groups you're offering and how you have been navigating the challenges posed to group work by COVID. So you could chime in the chat or raise your hand if you'd like to share a little bit about that. To jump back, I see that Shelley just put some information about the Texas Child Mental Health Care Consortium in the chat. Thank you for that follow-up, Shelley.
Can anyone else share? I see obviously telehealth is still emerging as a strategy a lot of you are using. Are there any successes or challenges or lessons learned that haven't been mentioned yet regarding telehealth that you could share? If so,
Nadira, I'm sorry. Nadira, let's see if I need to unmute you. It looks like you might be able to unmute yourself. Does that work?
Yes.
Perfect. Thank you.
For our organization, we're in Petersburg, Virginia. We are offering telehealth services, but the challenge we're having is getting students to log on. And so, of course, we can't offer the service during the school day or during school hours per se. And so we have to wait till the students have a break from school. But the problem is we'll get students to sign up for the telehealth service, but then they won't log on to join the session. And then when we try to reschedule, it's more so like a no-show appointment. So just getting students to come to their appointments. And I think it may have to do just with the fact that they're on telehealth school all day, first of all, virtual school all day. And so maybe they don't want to do telehealth appointments but that is a challenge that we're having. So we're trying to figure that out and figure out other ways to try to see students.
Thanks, Nadira. I also see that Carrie just shared in the chat about emotional regulation focused groups via telehealth. Carrie, if you could unmute yourself and share more about that verbally.
Yeah, we anticipated being swamped with needs for services. And so we were able to develop group curriculums for a range of age groups. So we have a preschool or young elementary school group that requires a parent's participation. We mail out activity kits a couple of days before each group, very simple, inexpensive types of things, but we found that that really helped with engagement, especially in the beginning sessions of group. We've had more participation of fathers than ever before, I think, ironically, because they're more likely to be home, working from home, or unfortunately unemployed. But the groups were our strategy to be able to serve more individuals more effectively. And our school-based health center is set up where we are open to every student in the district or every student aged youth in the community. So we draw a broad age range of kids.
Thanks so much. Just reverting back to the challenge that Nadira mentioned, I'm wondering if others are having challenges related to connecting with students and if anyone's had success with reaching students throughout the pandemic, perhaps via telehealth or other strategies that they could share. If so, please just raise your hand or write in the chat to unmute yourself.
Rebecca, thank you for offering to jump in. We would love to hear from you.
Hi, this is Rebecca. We had seen that some of the challenges that were mentioned with telehealth and connecting with students in a confidential way really were more prevalent a few months ago, and that school-based health centers found such creative ways of addressing that. So part of it has been when they're setting up a telehealth appointment to really talk through when we meet, where are you going to be? Who else is going to be home? What do you need to do to feel comfortable during this? So really front loading it before they get to the appointment so that folks think through their environment. And they've come up with some creative ways of doing that. Some kids will go to the bathroom and turn on the shower. Others have found that they can, now that the weather's getting nice, they're able to get outside more. Some folks have found that if they have permission to light off in their room, they feel more comfortable talking because they're not showing their home. So just kind of having that conversation in advance has helped with that engagement. A lot of the school-based health centers have also just done a ton of outreach. So just going through and saying, we haven't heard from you in a while. Who do you need to talk to? And really connecting with schools on how they can refer through the telehealth format. So we've actually heard some great success stories around how teachers have been able to connect a little bit more with kids in their own space, and they've learned the need. And then the school-based health centers have worked hard on reaching out to teachers to say, if you have concerns, here's how you can refer to us, even if our building's not open. So that has been a really positive way of engaging students around the state.
Thanks so much, Rebecca. Jessica Dyer, if you could unmute yourself and talk about what school-based health centers in California are doing regarding office hours for parents and virtual mindfulness.
Yeah, so there are a number of school-based health centers that have set every week virtual office hours. And the intention at first wasn't to be designed for parents, but what they found particularly with younger kids is that parents were coming on asking for support. And so it's just something that they've been offering regularly, that parents know they can go there on a consistent basis to get some support around how to handle, like everybody's been mentioning, when kids are exhibiting more anxiety or depression, but also help around how to set up a healthy home learning environment and how to get kids to be able to focus longer and keep them engaged. So that's been really successful. And then the mindfulness, a lot of clinicians have also partnered with teachers and just asked for 5 minutes at the beginning of different sessions and come in and led different mindfulness activities. And people have really appreciated all of those things.
Great, thanks so much. I see that someone mentioned classroom supports by counselors and psychologists. If you could unmute yourself and tell us more about that, specifically if it's in person or virtual and what that collaboration has looked like. So the comment mentioned was classroom supports by counselors and psychologists. If you could unmute yourself and share more. And I see in the chat that someone also asked about the family pandemic survey. And would like to hear more about that. So if you could either unmute yourself and share about the family pandemic survey or about the classroom supports by counselors and psychologists, please just raise your hand or chat. Okay. If you want to share later, we'd love to hear more, either about the family pandemic survey or about the classroom supports by counselors and psychologists. But for now, we'll move on to the next question. So on your Menti screen, please hit next question and we'll move on.
Erin, before we go there, it looks like someone did want to chime in. So I don't know if your first name is Roosevelt or Stacy, but if you would like to unmute yourself, we would love to hear what you have to say.
Okay, it's concerning the family pandemic survey. I work for school-based health centers in Rosenberg, Texas. And the family pandemic survey was designed, it was a collaboration between the mental health providers as well as the APPs, the nurse practitioners. And the goal was to assess what families' needs that may have arose during the pandemic. And it just asked questions like, are they due or past due for their well visits and their vaccines? Did they have any chronic health problems that they needed medication for? Do your child feel safe inside the home, outside the home? And based on their responses, we would then make the referral to whichever provider, could provide those services, like the dietitian or the clinical social worker or the nurse practitioner, or as well as the navigator. And we've gotten a few referrals from that also.
Thanks so much, Roosevelt. Just for the sake of time, we're going to move on to the next question. So please hit next on your Menti screen. So the next question is also related to challenges, but specifically during the pandemic. So what challenges does your school-based health center face in the provision of mental health services throughout the pandemic?
This one.
So I'm seeing access to students is a large challenge and more need than available support. I see in a comment in the chat something about assuring school counselors that are not able to take their, assuring school counselors that we are not trying to take their jobs. Does anyone have any advice for that scenario? So the comment was assuring school counselors that we're not trying to take their jobs. So I'm wondering if anyone has any advice or anything to say to that, a strategy that you've engaged in terms of collaboration with school partners and school counselors.
I see Nadira again. Nadira, you may still be able to unmute yourself.
Yeah.
Thanks.
Yeah. I know for us, what we do is at the Crimson Clinic, we work in collaboration with the school district. And so for the high school, we work in collaboration with the school counselors. So every week I join a meeting that the school counselors have, and we talk about the students together and how we can best support the students. How the Crimson Clinic can support the students outside of what the school counselors are already doing. And any meetings that I may have that I may need the school counselors to be a part of for the Crimson Clinic, I invite them to those as well. And so, we look at it more as a partnership and not this is my thing and this is your thing, more so.
Thanks, Nadira. Just for the sake of time, we have about 4 minutes left and one more question. So we're going to move on to the last question. So the last question we have is, what are the top mental health priorities at your school-based health center for the 2021-22 school year? So if you haven't yet, please click next question so that you can answer this in Menti.
I see, as you're typing, I see some really wonderful responses to the question about school counselors. And it looks like your responses may have come to all panelists. So if you're able to copy and paste, I see that Jordan sent a great response, as well as some other folks. So if you could send that to all panelists and attendees, that would be wonderful. Thanks.
Great, thanks, Emily. And again, this question is related to mental health priorities for school-based health centers for the upcoming school year. So in the realm of mental health, what are your priorities that you're keeping in mind for this upcoming school year? So identifying students with mental health needs, readjusting safety, anxiety, socialization. Is anyone formulating strategies to address these priorities? And if so, could you unmute yourselves and share? So I'm seeing depression and anxiety are priorities. Reaching students safely, providing referrals. If any of you can share strategies that you are thinking about to meet these priorities, and you can unmute, we have a couple more minutes and would love to hear from you. Or if you'd like to elaborate on any of these priorities. I see that someone mentioned developing a care team approach. If you could unmute and share more about that. We've also shared the evaluation link in the chat. So as you are submitting these responses, you also have access to the evaluation, which you would need to complete to receive CEs. And that's in the chat. Again, if anyone would like to unmute to share more about these priorities or to share strategies that you're planning to meet these priorities, please raise your hand or chat to unmute yourself. I see a comment about offering psychoeducation to support parents. Okay, well, it's the end of our time, so to be respectful, we are going to wrap up. But thank you so much for sharing all of your strategies and priorities and challenges. It was great to hear from you. Again, we shared the evaluation link in the chat, so please make sure that you click on that link and complete the evaluation, specifically if you'd like to receive CEs for your attendance today. You don't need to stay on the webinar to complete the evaluation, so you can go ahead and log off as soon as you click on that link. Thank you so much again for joining and for sharing all of your thoughts and opinions and how you're continuing to support students. Thanks, everyone.